Awesome. So yeah, so I'll be talking about dietary changes over a 15-year period. So in 21 countries from various regions represented in the pure prospective cohort study. As a little bit of background, so the global patterns and distributions of dietary factors over time and heterogeneity by country, by region, are generally not well established. Even more so, prospective long-term cohort studies that look at dietary trends are limited. So the traditional approach is to have repeat cross-sectional assessments, which are often in different participants and sometimes with different methods. So having dietary assessments conducted in the same participants using the same methodology is important. And this can help with nutritional initiatives and policies to develop and also to evaluate policies. So we looked at time trends in a few of the main food groups in the PURE study. So the PURE study has 21 countries of varying incomes across 5 continents and various regions, which you'll see in the figures shortly. So we looked at overall change, and we looked at change by income and geographic region. Diet was measured using a short food frequency questionnaire. And so because participants are doing follow-up every 3 to 4 years, a short FFQ was used to avoid being overly burdensome. So because it is a short FFQ, we weren't able to examine as many food groups as as a traditional approach with the longer FFQ, which is why you'll see only a few of the main food groups. So for this analysis, we excluded participants who had implausible energy intake, those who did not have repeat diet measures, and also those who had any events, because we really were looking at general trends in the population. So we didn't want it to be impacted by a participant who had an event and changed their diet, but we did do sensitivity analyses, both among participants who reported having any events and participants who reported changing their diet, because that was also a question. And so you can see that there's quite a substantial number of participants, ranging from 24,000 who had 1 repeat measure, and even up to 17,000 had 4 or 5 repeat measures. So there's a total of about 120,000 participants represented in these results. And to look at the change, we used linear mixed effects models. And so we had time and studies the fixed effect, and we had a random participant-specific intercept that was nested within center. And we adjusted for age and sex in these analyses. So this is the change in the main food groups over the full 15 years of follow-up. And this is overall in the full cohort. And what you'll see, so this is by servings per day. So it's the change over 15 years. So you'll see many of the food items, the changes were small. I think the most notable is you saw an increase in eggs and a decrease in vegetables. And some decreases as well in bread, rice, and fruits, and generally very little change in meats and milk as overall. However, there was variation by geographic and income, and so I'll show 4 of the food groups that had the most variation. So starting with milk, and so these are the regions that are represented. Both we have the geographic and we also have by income. And so for the change in milk, you'll see that it decreased in the North American Europe region, South America, South and Southeast Asia. Generally little change in Middle East, South Asia, and Africa. And really the only increase in milk was in China. And the decrease in Southeast Asia was a little bit surprising, because when we looked at the average intake, they did have the lowest intake of milk. However, there is additional repeat cross-sectional surveys during the same time period that also show this decrease in milk in Philippines and Malaysia, which are represented in this region. You can see an interesting pattern as well by income, where you see that high income and lower income decreased milk, whereas generally lower, middle, and low income increased milk. But the change was really the smallest for low income. And they also had the lowest consumption over time, both over time and also by the last follow-up. They continued to have the lowest consumption. So moving on to eggs. So overall, the change in eggs was also small, except for China stood out. So eggs were available for 10 years only because it was added later on as a question. But really, China stood out, and they ended up increasing by about 1 egg per day over 10 years. And you know, they went a little bit over the recommended of about, their recommendations for eggs vary, but there was an American Heart Association guideline that said, up to 1 egg per day is okay. And so they were actually became the highest consumer of eggs after this this increase. And really, it increased in all regions except, again, low income, really very small changes, and also the lowest consumers. And fruits, if we look by income first, so fruits had a similar pattern to milk, where it decreased in the higher income countries, but increased in the lower middle, and to a certain degree in the low income countries. And in terms of by region, so we saw decreases North America, South America, Southeast Asia, and Africa, and especially for Southeast Asia and Africa, this decrease is concerning because they're below the recommended intake. Whereas, it's encouraging to see, China, to a certain degree, South Asia increasing, as they're also below the recommended intake. And I think the results for vegetables were the most striking and sort of the most discouraging. So really, the largest decreases in vegetables happened in the 3 regions who also are the lowest consumers and who are below recommended intakes. So in China, Southeast Asia, and Africa. And I showed cooked and fresh, but really, these are the regions, China, Southeast Asia, Africa, they eat more cooked vegetables. So that's why you see the larger decrease in cooked versus fresh. Whereas, for example, North America, South America, it's about 50-50 for cooked and fresh. So you'll see that reflected as well in the decrease. And really decreased as well consistently by income region as well, especially in the lower middle income. And so I wanted to, the strengths of the study are really, it's the first global cohort that has repeat measures of dietary intake. It's prospective design. It has a high rate of retention over time. There's a long duration of follow-up. It's a standardized assessment tool that's used, every 3 to 4 years. We were limited, to 12 main foods. I showed a few of them here, but ongoing follow-up will have more foods, so it is a possibility with additional follow-up. And although it's a short FFQ, which has its limitations, it's often 1 item asked for fruits or vegetables compared to the longer FFQ, which asks, maybe five questions on actual types of fruits. It is a feasible method to obtain many repeat measures over time in such a large scale study like the PEER study. And just a summary. So overall, over 15 years, dietary change was modest, which was expected. We didn't expect to see, very large changes in relatively a shorter period for dietary change. But we did see variation by geographic and income region, really with largest shifts to milk, eggs, fruit, and vegetable consumption. All of the world regions showed a decrease in vegetable intake, but it was most pronounced in China, Southeast Asia, and Africa. And we saw a pattern where for some items like milk and fruit, the higher income countries decreased, while the opposite occurred for the lower income countries. By far across all of the food groups, the lower income countries had the least amount of dietary change. Really, so in the last 15 years, there hasn't been much improvement for many of the countries. Especially concerning for fruits and vegetables, which were already below optimal and recommended intakes. And our results were robust to sensitivity analyses when we looked at trend differences by age, also by participants who reported changing their diet, and whether a participant had an event, which might lead them to change their diet. So thank you so much. And that's all I have for today, but happy to take questions.